He's okay? Okay. Bam Cochrane.
Thank you. Thank you very much, Madam Speaker. I'm very pleased to rise and speak to Bill 9 today. I want to start by saying that I'm really proud of our Minister of Health for her leadership on this bill. It's a long time coming and long overdue, and I'm really pleased to be part of a government who's putting women's rights at the forefront. I also want to acknowledge that I'm entering this debate with a fair degree of privilege. I'm a cisgendered, heterosexual white male. I grew up in a nuclear family, so I pretty much check all the boxes of privilege, and I just want to acknowledge that before beginning. I also don't have any experience or know anyone with experience accessing these health services, but I do want to use an analogy of something that I am familiar with. In my former role as a registered nurse in the operating room, one of the most important factors for us was ensuring a good patient experience. If you can imagine, people are nervous going to the dentist. Can you imagine how nervous you would be going to have brain surgery? And it was our job to ensure that patients going in for such a procedure knew that they were in good hands and that they'd be well taken care of. And all of the experience that a patient has coming into a hospital from the moment they walk in the doors when they're going to have surgery affects their experience. And it was a struggle for operating room nurses when we're meeting a patient for the first time, and we have to give them the confidence that they're in good hands. So it was very important how we created a relationship with patients and made sure that they felt they were safe and in good hands and that they could trust us. So that was job number one for us, trying to ensure that patients knew that they were protected. And so when I think of a bill like Bill 9, there are a lot of parallels. A woman coming in to access a healthcare service deserves to have the same experience as though they were coming in for brain surgery. It's an important part of accessing the healthcare system for them. They may have made a very difficult decision to get there in that first place. And to enter a healthcare facility free of harassment and abuse and intimidation and bullying is so fundamental to having a good outcome. It's about how a patient starts and enters the healthcare system affects their entire experience and how they view that. And so I can't be more proud of supporting a bill that ensures that women can have easy access to a legal health service and be treated with the dignity and respect every other Albertan deserves. And so for that reason, I'm going to be voting in support of this bill, and I encourage all members to do the same. Thank you.